Hello, I'm Siobhan Laurent and welcome to LBfit, where we talk about what really matters, our health and happiness, but not just as individuals, as an entire community. Now, as you already know, it takes discipline and willpower to make healthy choices, but did you also know it takes having the right environment? And that's where community comes in, or having access to the infrastructure and services that ensure everyone's quality of life is supported and protected. Our topic today is older adults and what we as a city need to do to empower this diverse population so that they have equal access to the services and support they need and deserve. The key issue is what resources already exist, what's missing, and most importantly, how can we make sure older adults can actually access and use these services and programs? To help us explore this issue, we've invited several guests from Long Beach Health and Human Services and the Parks, Recreation, and Marine Departments, who right now are key providers of senior services for the city. To get us started, here is Kelly Colopy, who is the director of the department. So let's get started. Kelly, tell us a little bit about the older adult population.
So a lot of people think of older adults as being 70, 75, 80. Where we're concerned, the older adult population is anyone over the age of 50.
50?
50. So,
wow.
We all look around and everybody has friends who are 50 and everybody says, oh, I'm still young. And then the AARP invite comes up. And so all of a sudden, you're like, oh, older adults. But older adults really, they're very active older adults, all ages, climbing mountains, outside, riding their bikes, hanging out. And then there are some who are very frail and who are living a much more difficult life. And it's the mix of everyone in between.
Sure. So, I mean, it sounds like a very diverse population. What key demographic data has been collected?
Yeah, so we basically know that about a quarter of our population is over the age of 50.
Okay.
Just maybe 10% or so are over the age of 65 within the city of Long Beach. It's a very diverse population, which we celebrate in the city of Long Beach, right?
Absolutely, absolutely. It sounds like there might be some language barriers, though. Is that the case, or?
Well, about a third of our population say that they speak English less than very well, meaning that English is not their primary language, and that sometimes they have difficulty understanding English and being able to speak it.
Okay, fair enough.
Yeah.
What else do we know about these folks?
Well, we know that they're also very active. When you look at who's in our parks and recreation centers, they are doing really cool things, and we'll be hearing more about that. But we also know that we have some that live in poverty and have disabilities. So we have about 13% of our older adult population lives in poverty, which is about $11,700 a year. We know about 40% have at least one disability, and that may or may not interfere with their ability to have just a wonderful life. It just happens to be what it is. So those are some of the key things that we also pay attention to.
So what are some of the key issues they face?
Well, many older adults live in social isolation. And so what that means is that they're home, but they don't have a lot of visitors. They don't have a lot of community engagement. They're really they're living there on their own. And so what we're really encouraging is communities to start to work together to support them, and that to have programs that are visitors, home visiting programs that bring food, other ways to start to help out the isolation. We've talked about poverty already. Mm-hmm. When you have people with disabilities or they're beginning to be frail, it's much more difficult to have transportation. So, what they find is that it's difficult to get to the grocery store, and it's difficult to get to your medical appointments. Sure. And those. So that's a key thing that people really focus on. And then the other is really around their safety. So safety in their homes. Are they going to be falling? Is their apartment and place that they live, is it safe? And are they safe on the streets as well? And there are a lot of people who like to con seniors, right?
Right.
So it's really like, what does that safety look like? So those are some of the key issues, as well as medical supports is important too.
So Kelly, what would you say would make a difference?
Well, I think we know that within our city there are all kinds of incredible resources
Absolutely.
For people. The problem is nobody knows about them. And so one provider may not know that somebody else provides a service, and when we're trying to make connections. So there are a couple things that we're working on. Okay. One is to really make sure that people know what's out there. So if you're looking for some kind of service, you want to be really active, you want, whatever it looks like, how do we start to connect people to activities and services that will fit what they're looking for? And then the other piece for us is really saying, okay, there are so many groups. Are we working together? Are we doing what's best strategically to really provide the best situation we can for all the older adults within our city?
That's fantastic. That's fantastic. So thank you. When we come back, we'll take a look at some of the programs and services that are already available to older adults right here in our community. Welcome back. Right now, the majority of services aimed specifically at older adults are provided by the Department of Parks, Recreation, and Marine. To tell us a bit more, we have Lori Jarmez, a recreation superintendent who oversees the city's senior centers. Lots of communities have senior centers, and I know Long Beach has several, but can you tell us a little bit more about what's offered at these centers in our community?
Sure. The Department of Parks, Recreation, Marine, we have actually 6 senior centers in the city. Our 4th Street location, our Long Beach Senior Center, provides activities and programs exclusively for seniors. We also have at our regional parks, Cesar Chavez Park, Houghton Park, Silverado Park, McBride Park, and El Dorado Park West, community centers that provide activities and programs for seniors as well.
So tell me about what these folks are doing at these senior centers.
We offer something for everyone, from dance classes to art classes to ukulele classes. We have trips to different destinations and locations within the local area. We also offer classes, physical fitness classes that emphasize flexibility, balance, and energy. Just something for everyone.
That's amazing. And this occurs all day long?
Most of the senior programs are offered between 10 and 2 at our 6 sites, as I said. But one thing that we also have is our swimming pools in Long Beach. And water.
We need that right now. That's incredible.
Exactly. And water is a very forgiving environment, and many of our seniors enjoy the pools. We, thanks to City Council, have an opportunity for anyone who's 50 and older to participate in water exercise classes at no charge at all 3 of our public pools that are operated by Parks and Recreation. So we encourage everyone to take advantage of that and participate.
What about some of the more fundamental things? Utility bills, housing, things of that nature?
At our 4th Street location, we do have an office of information and referral that provides vast information to residents regarding assistance with utility bills, food bank information, transportation, bus tokens, and taxi vouchers. It also provides information about the Housing Authority, and we help people find what they need within the city for a variety of different services.
That's awesome. So they can come in pretty much with any question. And is that available all day?
It's available between 8 in the morning and 4:30 in the afternoon, Monday through Friday, at the 4th Street Senior Center.
That's fantastic. What a great resource.
And what's interesting about that is they get about 1,200 calls a month. So it's not like it's barely used. People use it a lot.
So that brings up a really good point. They don't have to physically come there. They can just call in and use this resource as well.
Yes.
That's so great. Transportation is an issue as well. Is there anything that's available in terms of transportation?
Here in Long Beach, we participate with the county, partner with the county, I should say, to provide a program called Access that helps residents connect from one public transit authority to another. We also have, as I mentioned, our bus tokens and taxi vouchers that are available to residents who have immediate needs for transportation, which could be to medical appointments or court appearances, or perhaps they need a ride to a food bank or a food distribution location. Long Beach Transit also offers discounted rates for seniors and a dial-a-ride program as well that can help seniors and older adults get around the city.
That's awesome. So, and where can folks find out information on how to get that dial-a-ride and things of that nature?
The best location to find information is the Long Beach Transit website, which is lbtransit.com. You can also contact our information referral office at the 4th Street Senior Center, and they can be reached by calling 570-3500.
Perfect. So how many older adults would you say we're serving right now?
Last year, our department recorded over 560,000 visits at our 6 senior centers and our swimming pools by older adults within our community. And last month alone, we recorded over 43,000 visits.
Over 43,000 visits. That is a big number.
It is a big number, and it's again, it's at our 6 different sites and our swimming pools. It's people that are engaging in classes, activities, lunch program, all of those kinds of things.
So it sounds like we're serving a huge portion of the population, but yet there's still more that we can afford to reach, right? So what would you say are the challenges?
Absolutely. The challenges are making sure that the older adults in Long Beach know about our programs, know what we have to offer, know that we offer from a dance or a cooking class or just a club that gets together to crochet or knit. Those are opportunities that are offered throughout the city, and it's our job to promote that so people do know that it's out there so that they can come in and be a part of that.
So we're saying this is the biggest kept secret in town, and we're sharing it right now. Is that what we're saying?
Yeah, I would say so.
That's amazing. I'm glad we're doing that. So what would you say, who is it that provides insight into these programs?
We have a Senior Citizen Advisory Commission, a 9-member commission that is appointed by the mayor's office, who advises the mayor and city council on issues that related to older adults in our city. We also have at the El Dorado West Senior Center a Friends of the Senior Center group that participates in fundraising activities and advises on programs that are offered there. We have a similar group at the 4th Street Senior Center as well that provides insight and suggestions and also does a significant amount of fundraising to support the programs that are there. For example, the 4th Street Friends group just recently purchased 2 new treadmills and 3 new stationary bicycles. And the cost of that new equipment was over $13,000.
Wow.
That was raised by this group that supports the 4th Street Senior Center.
So how does one get involved with the Friends program?
It's just a matter of making that connection, calling the senior center, stopping by, or making the call to the senior center, and our staff will be happy to make that connection.
That is fantastic. Well, thank you so much for that information. Let's take a quick break, and when we come back, we'll meet the city's Senior Services Public Health nurse, who also works out of the 4th Street Senior Center. We'll be right back. Welcome back. We've been talking about all the different programs and services offered by the city's Park, Recreation, and Marine Department. But now let's turn our attention to the issues surrounding the health and safety of our older adult population. To talk about this, we have Janine O'Hara. Hi, Janine.
Hi.
So I know Parks provides most of the programs, but what about the health department? What's provided?
The health department has several programs that we provide to the older adult community. One of our special programs is called Senior Links. It's housed within the nursing division at the health department. The nursing division receives numerous calls each year to go out and make a home visit and evaluate the seniors that are living within our community.
So how many calls does the nursing division receive each year?
We receive about close to 4,000 calls, and a percentage of that are senior related home visits that we make. We go out and we try to focus on case management. We, before a crisis develops, what we try to do is provide them services that they might need in the home.
Just for my understanding, if you received a phone call and I was saying, you know, my mom needs XYZ,
yes.
What does that evaluation criteria really look like?
Well, sometimes a family member calls because they're very concerned. Sometimes we receive calls from Northern California across the state because they have a loved one that lives here in Long Beach. And what we try to do is tell them that we can make a home visit. We go out and we do kind of a screening to see what their needs are. And then what we try to do is link them and connect them with the resources in the community. So we might go out and find that the person is unable to get to the grocery store.
Okay.
And then what we want to do is link them with a program called Meals on Wheels. Or we send them to our senior center so they can participate in the congregate meals and enjoy the social aspect of what that looks like.
See, it sounds like you have partnerships with a lot of other programs.
Yes.
Can you speak to some of the other programs that you
Well,
partner
we
with?
try to connect and bring all the resources together that we can. There's different variations of where the senior is in their stage of their life in aging in place. Some seniors are very active and all they need is a connection with a home delivered meal, and some other seniors are at the point in their life where they want to remain in their home but they're in need of a caregiver.
Okay.
So we might call Independence at Home, IHSS, and they will help them with a caregiver referral.
So it sounds like it's a great way, a great resource that folks can use to better aid our older population.
Yes, absolutely.
That's amazing. So are there any other offerings that the department has?
Yes, at the department we also focus on fall prevention. 1/3 of people over 65 fall each year. 1 out of 5 of those falls result in major injuries. So what we have to do in the community is develop programs that offer fall prevention. The good news is we at the department engage and we make partners so we can focus on this issue.
What does the screening process look like?
Well, what we do is we have an event at a church or the senior center, and we bring seniors together that are interested in their fall risk. We ask them to fill out a fall risk questionnaire, and some of those questions are about, are you afraid of falling? Have you fallen in the past year?
Okay.
Do you take medication? Do you get dizzy? And then we assess whether they're at, we look at that questionnaire and we assess whether they're at risk for falling. And then we do 3 different tests. And we look at their balance and their physical mobility.
Okay.
And after that, we measure their chance of falling and we let them know if they're at low risk of falling, moderate risk, or high risk of falling. And then we make recommendations based on that.
Got it. Okay, so now when you said you do 3 different tests, are those like a physical test that they do in addition to the screening that they've just filled out?
Yes.
Okay, so what does that look like?
Well, it looks like we ask people to sit in a chair and then take a 12-inch walk around the room to see how their balance is. We ask people to sit in a chair and stand, and we time them and see how many times they can get up in the chair. And we're looking at their balance and also their strength in their muscles.
I'm curious, what are you looking for? I mean, how many times would an average person be able to sit and stand?
Well, good question. You would think, it would be a lot, but most people, and especially the older adult, we time them for 30 seconds, and we're looking, depending on the age range, for them to get up from the chair 12 different times.
Okay, 12 times.
And if you are injured or have a knee injury or something like that, it could be very difficult. So then what we would do is ask them to participate in a workshop, a class in the community that could enhance and increase that strength so that they would minimize or reduce the risk of falling.
So that's fantastic. So there's no need to fear, there's no need to try to cheat the system and try to get the 12. The best thing to do is to do the best you can, sit, stand, fill out the test honestly.
Yes.
And then ultimately there are ways to remedy this, is what you're saying.
Yes, there are programs out there, and one in particular is called Stepping On. And we provide classes in the community. It's a 7-week course where a senior comes once a week, and we give them knowledge about how to get up from a fall if they've fallen. We identify their risk factors, like low vision. We identify if their balance is weak. We provide exercises in the class. We invite guest speakers to come, experts like physical therapists, to teach them these balance and strength exercises.
That's fantastic. So in particular, if their main problem was really that they had a fear of falling, this would really help alleviate that.
Well, how we do that is we have to build a lot of confidence in the senior, because once if they've experienced a fall, they are a great fear of that again. So what we do is look at risk factors, and then we ask them to go home, for example, and look at their environment, see if there's any modifications they can make in their home, like especially where people fall. The #1 room that people fall in is their living room.
Really? I would have thought the bathroom.
Yes, most people do.
Yeah.
And so what we ask them to do is to evaluate whether they have throw rugs on the floor and to remove them. We ask them to cords that may be out where they could trip over, to remove them.
It's a really, really valuable resource. Thank you so much for that. After this next break, we're going to find out what's being done now to help address some of the gaps in the services that we've been talking about. Glad you're back. As you've heard, nearly 1 in 4 people living in Long Beach are older adults. And with our population aging, those numbers will continue to grow. Making sure there is a strategic plan that addresses this diverse population is essential. But how should we create one? And what should it include? Kelly, I know that there has been a lot going on with our community. There was a plan back in 2005, and there's been a recent update. Can you tell us a little bit about that original plan and this new update?
Yeah, so in 2005, many community members came together and led by the health department and created a strategic plan for older adults. They had about 500 people who provided surveys, focus groups. I mean, they talked to everyone and it came together. And there have been a couple other updates to that as well, like different studies conducted by Cal State Long Beach and by different hospitals and things. So we're really starting to get a clear perspective about what needs to be done. And then most recently we had a summit where we brought together many providers and said, what are you seeing? You know, what's happening when they call you for case management? What connections do they need? So we were able to pull together really input from over 1,000 people that over the 10 years. And what we're noticing is that the issues aren't changing that much, right? Because there are those core issues that everybody faces. So the key things that are really showing up are transportation, safety, health, sort of overall connection to community, and sort of the housing. And so those key things pop up throughout.
Sure. Okay. So in comparison to what we found in 2005, you're saying that it's pretty much the same now, or has it gotten worse?
Yeah, it's not so much that they've gotten worse. The issues have remained the same.
Okay.
Some of the details may be a little bit different. It might be a little bit more difficult to find housing, or there may be, there are some other issues around transportation. But overall, the key themes that everybody really thinks about, it says, okay, this is where we need to make a difference. Those are the key same areas that we're working on.
Sure. Okay. So what are the key recommendations moving forward for 2016?
Yeah, so what all the planning people, everybody involved has really realized is there are a lot of resources in the community that people don't know about. And so one of the key recommendations, one, is to start an older adult task force and pulling in older adults who represent many of the community providers, community members, the school systems, just everybody together are coming in and saying, okay, how do we want to do this? What are our best ways to address it? Where are we going to find our resources? So we're really going to be working on pulling together this older adult task force.
That's amazing.
And then another piece is this sort of one-stop network. And so because right now there's so many different people providing service, and we do have the information and referral service that we talked about a little bit earlier, but the demand is so much greater than what they can handle. And so really just to put together this one-stop place where everybody can find all the information they need and be able to be referred to it, and making sure that we're, a lot of times we refer, like different providers will refer to somebody, they'll say, oh, these guys are great at case management, I'll just refer you there. But then they may have a really long wait list and they don't have room to take that person on. And so what we're trying to build is those relationships between all the providers so that people are being referred to places that are ready for them and that have the ability to serve them right when they need it instead of long wait lists.
Okay. So how are you planning on identifying these individuals?
So, yeah.
Well, what we're going to do is invite those people, seniors in the community and other service organizations that would like to be part of the older adult task force. And then from there, we would start identifying who those people are that really know what seniors need and where their services live in Long Beach.
That's great.
And part of the one-stop piece would be, yes, a phone number or a place to visit, so to really build and strengthen the capacity of the information and referral group, but also to start to create online opportunities. So there would be a database that had all of it in there, and there might be an app that has all of it, that maps it out and shows you where things would be. So it's really expanding the ability to learn about it, because some people are super tech savvy and others aren't.
Sure.
And so it's be able to serve older adult population and their family members, whoever's trying to help them, wherever they are, whatever's easiest for them to be able to get to the service.
So it'll be something for everyone.
Yeah,
ultimately,
that's the goal.
Which is
Yeah.
incredible.
Right.
So if folks want to stay up to date on how this is progressing,
Yeah.
where should they go? What should they log on to? How can they stay up to date with this progress that we're making?
Yeah. Right now, I think it's going to. Right now, we're just getting moving on the older adult, on the task force.
Okay.
And I think so. If people are interested in participating, they should definitely be. They should be definitely calling the health department, and we can start to connect them to that as we're putting that together. And then I think through our website, through the health department, and also through the Parks and Recreation website as well. We'll be posting updates, and people can learn more at the senior centers as well.
Thank you for being here today. This was really helpful in helping us better understand a bit more about our older adult population and their needs. If you have any specific questions, be sure to call the city's Information and Resource Center at the 4th Street Senior Center. Also, please keep in mind that our Long Beach Health and Human Services Department offers a full range of services to our community, so please check out their website. It's chock full of information. So with that, thanks for joining us. See you next time on LBfit.